Okay, great. Happy lunchtime, everyone. Thank you for joining us for a discussion about Women, Infants, and Children program, better known as WIC. I'm Kelly Caseman, the Executive Director of Think Kids, and with me is a great panel of WIC experts who are going to tell us more and take your questions. Feel free at any time to post them in the comments, and we'll get to them as the conversation progresses and time allows. Let's meet our panelists in alphabetical order. Jody Giancola, who is the breastfeeding coordinator for the Office of Nutrition Services at DHHR's Bureau for Public Health. Diane Landy, agency outreach coordinator with WIC in Southern West Virginia. Dr. Lisa McBride, who is a pediatrician and owner of Cardinal Pediatrics. And Molly McMillian, special projects consultant, West Virginia Perinatal Partnership. Thank you all for joining us this afternoon, I guess.
Thank you for having us.
Sure. Let's jump right in and start simple. What is the WIC program and what are its benefits?
Do you want me to go with that? All right. WIC is a supplemental nutrition program. It's under the umbrella of the United States Department of Agriculture, but we have WIC in every state. And so it's supplemental, so it's not meant to be fully full benefits for people each month. It's free. It's for eligible pregnant women, breastfeeding and non-breastfeeding postpartum mothers, and infants and children up to the age of 5. Are you ready for more?
Sure.
Because again, I don't want to usurp anyone on this panel. We provide nutrition. I think what makes WIC different is what I like to highlight, because a lot of times people think like WIC and SNAP are the same thing, and they're really not, because WIC is really a supplemental program, and we're really for a certain category of people, obviously women, infants, children. But what we also do differently is that we provide a lot of nutrition counseling, parenting advice, referrals, and breastfeeding support, which is my area. So we do a lot of things to really help families live a healthy life. So we're not just giving them any kind of food. The foods that we give are based on the national, the NASEM, what is it? National, oh gosh, because I'm on camera, I'm gonna forget what NASEM is, National Academy of Science, Engineering, and Medicine. So they're based on that and the dietary guidelines. So we do very healthy foods for families, and we're really trying to help women, infants, and children in those categories be healthy and have better outcomes for pregnancy and health all through their lives. So I think that with WIC, it's different than just like a program that just gives money for food.
Right.
Like we help them.
May I join in here?
Absolutely, Diane.
Okay, thank you, Jody. It's known as you said, the special supplemental nutrition program for women, infants, and children. And many believe that it is a critical federal food assistance initiative. It was established in 1974. For almost 5 decades now, WIC has served as a vital safety net program for families facing food insecurity by providing access to healthy foods, breastfeeding counseling, nutrition education, and referrals, as Jody said, to other health services. And research has found that many health benefits for WIC participants have resulted in healthier families, such as reductions in food insecurity, obesity, healthcare costs, and improved social service utilization, because we do those referrals. And additionally, through the establishment of our food package, our nutritious food package, which is free for our program participants, we help support our farmers, our food manufacturers, and grocery store vendors nationwide. And we provide healthy food options in retail environments for communities across the country.
Well, that's a great explanation. Anybody want to
Well
add?
said, Diane. That was really, she said that very eloquently, and I have to point that out. So
thank you.
And again, for me, before I came to work for WIC, I did not know as much about it as I do obviously today because I work for WIC. But what I really do love about our program is like, so for example, Molly McMillian, who's on here today, because Molly is so important in breastfeeding in West Virginia, we do a lot of work together. We do a lot of partnership to kind of really bring breastfeeding out into the community. So that is really one of our big missions in WIC. A lot of people think that WIC is there to provide formula. And yes, we do provide infant formula for those that need it. But our mission in WIC is to really support breastfeeding. So again, we're trying to change the culture in West Virginia. We're working on it as hard as we can. And again, working with Molly, especially, we've done a lot together to educate even like early childhood, like in some of our places like when in daycare centers, so they can actually like reimburse for giving breast milk rather than just getting reimbursement for giving formula. And that's, you know, evening things out across the board. Like they shouldn't get reimbursed just for giving formula, but not for offering breast milk. So again, we are really supporting and helping our WIC families because again, you know, making sure that we regulate, like make it normal for breastfeeding, make people think about breastfeeding. And right now I'm actually in the process of the new breastfeeding training that came out from USDA was released in April of 21. And I started rolling out the level 1 this year, and we are almost finished with that rollout throughout the entire state of West Virginia. And then we'll be going on to level 2, and there's 4 levels. So again, we do a lot of breastfeeding education, even within WIC, to really help support our breastfeeding families. So I feel like we're out there trying to do like the best nutrition that we can for families and trying to support families where they are. So,
Jody, what kind of, is there data out there? What are our breastfeeding rates in West Virginia?
our breastfeeding rates are lower in West Virginia than they are with like the national average of WIC. Right now, like probably this year, I'm trying to think, I don't even know if I know exactly where we are this year, but I know we've gone down. Thank you, Molly. I know that Molly's pulled this up for me because she's always on data, which is wonderful. So if you look here, and Molly, I'll even let you talk about this because it's your slide, but if you notice, like you can look at the US rates in that first, and then West Virginia is below that. And again, it's really a culture change, and we're working on it as hard as we can. But I will say the data that I have from WIC is that WIC does make a difference in breastfeeding, and it has like across the board. It's just, again, in West Virginia, even though like we have more breastfeeding or more exclusive breastfeeding over time, so we've helped over time, we're not at the level of where we want to be as far as the national average. And so again, there's work to be done, which is why Molly and I are planning initiatives all the time.
Joined at the hip.
Go ahead, Molly, talk about your slide because this is
and it's hopefully going to be updated really soon. With our 2022, we get a breastfeeding report card every couple years from the CDC, and that's what this is showing. And we're now in the 2030 healthy people goals and all. And going forward, they're not going to look at so many categories. They're going to look at our percentage of babies who are being just breastfed, nothing else, at the 6-month mark. We call that exclusive breastfeeding. And then how many babies are breastfeeding at a year. And that is because, excuse me, research again and again shows that the more moms breastfeed and only breastfeed, the longer they tend to breastfeed and all. And that has to do with how the whole system works and how moms make milk and all. We'll still get the other numbers. Like for instance, you see 69.9% of moms, or I can say infants, are ever breastfed. And that can just be one time. But that is when they leave the hospital, they've been breastfed. We know from internal numbers within the state that around an average of 57% of women intend to breastfeed. But a lot of times things happen with delivery and various things, and they don't leave just breastfeeding. So we have a lot of work to do on many angles. Like Jody said, and we have steadily improved in our rates. I like to say we're doing better with improving breastfeeding rates than we are with our pregnant smoking rates, but that's another story. We're improving, but we want to do more work around this 6-month cutoff. And part of that, well, a lot of that has to do with educating our moms. Families, you'd have to live under a rock to have not heard that breastfeeding is good for babies. But being able to connect, I hear it's good for them, with how it works and how can it work for me is a big stretch. And also part of what the West Virginia Breastfeeding Alliance has been doing in the state for many years now is doing training. And we train healthcare folks and more recently folks in the community, all different levels of training to be able to help mothers along the way, because go figure, we don't have enough. We need more support for moms. And then a lot of the effort that we're working on now is going into the prenatal period, because women don't generally have a lot of time or realize the importance of even taking a childbirth class before they have a baby, and much less a breastfeeding class. But we find time and time again that mamas who have had access to good information and been able to ask questions, they're the mamas that are able to overcome any problems that they hit. So many of our moms go back to work at 6 weeks, many of them less than that. It's a scary statistic in the world that 1 in 4 women, in the US, 1 in 4 women go back to work at 4 weeks or less after having a baby, because we have no paid leave universally. So we go figure our breastfeeding rates really drop off after they do that, because that's a huge change for everyone. Some women don't even try it because they can't imagine, how am I gonna pump at work, or I don't have a pump. These are all places where WIC comes in. On that education part, we can help folks through our cooperation. We're working to make it easier for moms in the state to get that breast pump. It's a federal mandate, and it's not new, that insurance and Medicaid provide breast pumps. A lot of women still don't know that, okay? And they don't even know that it's a federal law that they be allowed time to pump at work, and a place to do it that's not a bathroom.
That's not a bathroom, exactly.
Yeah.
Not a bathroom. We tell people that, and it's like, no, you do not have to do that in the bathroom.
Yes.
And that is really, I think that is a big thing to really, because it is one of the things that we do. And I do get questions a lot at the office about going back to work. And
Yes.
how do I even think about that? So again, I think I mentioned that we're doing our new USDA training, breastfeeding training, but that is really addressed in there. Like, how do we, as WIC workers, people that are staff for WIC, how do we help communicate to our moms, what can we can't just tell them, oh, you can do it like that. That doesn't help. They need real solutions. And so things that we can do to help them feel like, how do you involve the other family members in education about breastfeeding? Don't forget partners and grandparents, bringing the whole family into it. And I think to go off a little bit, this pandemic has really shown us a lot at WIC that we can do things in a more hybrid way. Because I think one of the things that I always think about with people that have low socioeconomic status, they struggle in the world but they struggle even more with the things that the rest of us struggled with. So for example, one of the things that I'm really hoping that WIC eventually will change regulation to do is to allow WIC participants to pick up their, their groceries and like have like click list or whatever you would call it. That is not a WIC benefit right now. I mean, they can go get their food and we have everything on EBT card. So that's, and we've done that for years. Like we are like our West Virginia is ahead of a lot of the country when it comes to like shopping, having the EBT card and having benefits put on the card. And then also our WIC shopper app, which they can also take to the store and it can like scan foods and let them know that that is on my card, which is such a big thing. They can do education through their WIC shopper app. So we are really technologically, up there at the front of the group. I'll say that. And I'll give credit to Denise Ferris, who is our director way back when we had the opportunity to do this. And she said, no, we need to go right to EBT. And I think that was probably like 2012. I mean, and that was a long time ago for EBT. There are people that are just now still starting to do that. So I think that with the pandemic, it's really made a difference in realizing how much families struggle and what can we do to help our WIC families get the aid that they need from us and support them from a distance. Like, yes, we still need to do heights and weights and hemoglobins, and I get all that, but we also need to come up with ways to reach them and maybe do education, just like we're doing this Zoom call. Like, can we do things this way to make it easier on our families that have transportation issues, which is a big thing.
That's great. I want to hit on that before we're done, but I want to circle back to an important point when it comes to the WIC program and who actually qualifies, because it seems from the data that I saw that precipitously kids, they utilize the program less as they get older. So who qualifies? Who can receive support through WIC?
So you want to go with that? Do you want to answer that, Diane?
Sure. Pregnant, breastfeeding, and postpartum women, infants, and children up to the age of 5 living in a household whose income is no more than 185% of the federal poverty income guidelines. And additionally, families that qualify for Medicaid, TANF, and SNAP automatically qualify to receive WIC. And also all foster children under age 5 are accepted into the WIC program, regardless of the caregiver or foster parent's income. And WIC provides services to married and single parents, working or not working, fathers, mothers, grandparents, foster parents, or legal guardians who have custody of a child under the age of 5.
And then I'm going to add to that we really always also think of medical risk or nutritional risk, because that's one of our 4 categories. We talk about the, whether you're a pregnant, or breastfeeding an infant or child, but also they have to be a resident where they're getting their WIC benefits, the income guidelines. But we also want to add to that the nutritional piece, because most people that are going to be on WIC are going to have some form of nutritional risk, which is going to affect their lives. And that's again how we're different from SNAP, is that we affect their nutrition education. We provide really healthy foods, so we're addressing that nutritional risk as well, and making sure that they have better outcomes of pregnancy, better, even if a child doesn't go through WIC all the way through their 5th birthday, until they turn 6, they still will get they'll have better outcomes health-wise, because again, we refer and we make sure people get their immunizations. They're constantly being seen and educated on how to feed their families, how to cook the foods that we give them. So we provide a lot of education for our moms. And what's really neat is, I mentioned the WIC Shopper app. One of the things that we've been doing for a long time is we do nutrition education modules that they can do online. And so that really helps with this generation being able to do some nutrition education. And while they only have to do maybe one nutrition education module, we probably have somewhere like 57 different modules now. And some of our families will go home and do multiple modules, even though they don't have to. And then they bring their questions back to WIC when they talk to their nutritionist to say, hey, I watched this module and I have some questions, and they'll write stuff down and they'll get really excited about things. So I think it really helps kind of the way that we do things in WIC is we talk about VENA, which is value enhanced nutrition assessment. And we always try to do things on the basis of the person. So it's what are their needs? And we try to meet them where they are. And so what I love about this is they can come in and talk about, like, you know what, maybe we're concerned about their iron. And then they go watch a module on iron. And they also talk to their nutritionist, but then they can come back with questions and we can really further that education and take it to another level, because it's like really like focusing on that individual. And so even our families that don't stay on WIC the whole time, and I know that's what your question was, Kelly. And again, I think that a lot of that has to do with the difficulties for low-income families with transportation. And I'm going to say this because it's honest. You have to weigh out the cost benefit of everything. And I think when we get families when they're pregnant, I feel like at that time, we all know that when you're pregnant, you want the very best. And so I'm going to quit smoking. I'm not going to do drugs. I'm not going to drink. I'm going to do all these things because I want the best for my baby. And I'm not saying that later they don't want that, but like a child food package is probably worth like a little under $40. And so when you think of the price of gas and the fact that I may not have good transportation and my WIC local clinic might be really far away from where I live, we kind of need to meet our families in a different model. And so again, that's going to come all the way from the federal government. So USDA has got to make some change in regulations for some of that. But I feel like if we could make things a little bit more easy for our families, then we would keep them longer. Because again, once they get to school, they can be on school lunch programs, etc. You know what I mean? So there are other things where they might say, you know what, it was worth it back here because I was pregnant and I was really trying to have this really healthy baby. But now, you know what I mean? And if they're getting SNAP benefits, they might say, well, that's enough. So I just feel like it's a little bit more of us kind of working to make the model a little bit more hybrid. That's just my opinion. I won't say I speak for all of WIC when I say that, but I just feel like you have to do that cost benefit. And if it's hard and they don't have transportation, they're not going to stay all the way through the time that the kid is 5 years old. So, Diane, do you have anything to weigh?
Sure. With the cash value benefit increase too, the package becomes worth even more. And let's just hope that that stays.
I feel it will.
I think there is a wonderful, if anyone is really interested in researching this more, what you have been referring to boost technology and innovation in WIC is, I think, based on an initiative called Wiring WIC, Health and Technology Initiative of Nutrition, which was done, it began in actually 2017. And it was with Harvard T.H. Chan School of Public Health and MIT Media Lab, supported by the Rockefeller and Aetna Foundations. And they convened experts in public health, nutrition design, and technology to identify these interventions to wire WIC with cutting edge technologies, exploring a range of opportunities to leverage mobile phones, apps, the internet, social media, texting, video conferencing, and other innovations. And so, as you said, West Virginia WIC has been fantastically way ahead of everybody else. I mean, they have, and with the help of Denise Ferris and Kathy Legg at the state level, I think Denise and Kathy actually contributed some to this initiative. And they just recently came up with further suggestions, which I'm sure they're going to follow through. At present, in the wake of this pandemic and beyond, the experts believe that WIC's continued success will depend on our ability to serve new generations of beneficiaries through user-friendly digital systems and tools, and in conjunction with in-person services. So most of today's new parents are millennials and Generation Z that are highly connected, as we know, to technology, and especially keen on usually using social media. So we've been on the go with social media now. I man a social media page for, I guess, 4 years or more for some of the agencies. And not only do we educate there, but we can promote the program and hopefully influence people who are out there to get on board and change the image, for these millennials and Generation Z.
And to add to that, this might be the place to say this. One of the breastfeeding aids, we'll call it, that we offer from, in West Virginia is we've actually contracted with Pacify, which is a lactation app that basically they hire their international board certified lactation consultants, which Molly is one, by the way. I'll just throw that out there. And so when we think, thank you, whoever pulled this up, but basically this is a WIC benefit. So if you are a person that's on WIC, you get a code from your clinic that allows you to have 24/7. It can be it's like FaceTime, a call with an IBCLC. They answer the phone in less than 30 seconds. We don't want it to replace our own lactation specialists, but what we want is that extra layer. So all of us can't work all night, all weekend, every holiday. Right. And so this is what we do to help them have that 24/7 extra support. And then every week I get reports from Pacify on any call that's gone through. And then I basically securely send that out to the local agencies so they can follow that up and put the care plan notes into the care plans and then follow up with the person that called in. And so it's a way for us to just kind of add some extra support. And I've been really happy with it. It started right before I started with WIC in December of 2019. And I feel especially over the pandemic, it was a little hard because we had just rolled it out when the pandemic hit. But I feel it's been a lifesaver for a lot of families because it's again, at the beginning of the pandemic, they didn't even let, you have anybody in the hospital with you. They surely didn't let lactation consultants come in and help. So for some of our participants, having that connection to lactation support. And the way we do our app, they can also call their local clinic. So they can not only call lactation consultants, which do a lot of not only lactation, because that's their goal, but they can do a lot of infant feeding questions as well. So it's just giving somebody that, what I call warm voice in the middle of the night to kind of support. And it's something that we're using as again, a benefit for our WIC families in West Virginia. And it's been so far a good contract. And I think it's been very helpful to a lot of families. They've never rated the app poorly. It's always been, close to a 5 on a scale of, 1 to 5. So I feel really good about that.
So quick question, how does one become a WIC family? So what are the different doorways in which people can get connected to WIC?
Lots of different ways. And I know I'm going to say Diane can answer this as well as I can, but I can tell you we have a website. So we at DHHR, we have a West Virginia WIC website. So that's one way. We have a phone number. That's our local agency phone number. And I have all this on a slide, which I probably should pull up so you can see it. But they can go to their local clinic. We do outreach all the time. So again, it's whatever, hopefully our physicians are encouraging their families. So there's so many ways to get connected to WIC, but I probably, let me see if I can share and grab my little PowerPoint.
Dr. McBride, would you like to, while she's pulling that up?
Sure. Yeah, I think it's important for any medical provider in the community to screen for all of our children. And that's all children, not those they just think might need it. We screen universally. So it's another vital sign that we take in our offices. It's called the hunger vital sign. And it consists of just 2 simple questions that medical providers in any setting, at any age, with any family can ask. And the first question is, if the family feels at any point, or if they were worried at any point in the past 12 months that they would run out of food before they were able to have enough money to buy more food. And it's a simple yes or no. And this can be either written, that they respond via the multiple questionnaires that you give families for the well visits or any acute visit at a physician's office. But then the second question that they answer yes or no to is just, we did in fact run out of food. We did not have enough food prior to the time that we had enough money to get it within the past 12 months, a yes or no, simple question. So those two questions need answered, and it can be either verbally asked by the medical provider to each family or a question given in a written format, so that the families feel free to share and be honest with their medical provider, because 1 in 5 children in America are hungry. They live in a food insecure home, and it is in all of our clinics. And so any medical provider, whether they're a family medicine, medical nurse practitioner, pediatrician, physician assistant, everyone should be asking their families about food insecurity. And it's very simple and it's very easy to do and quick.
You know,
I'll add, I'm sorry.
Okay.
I'll add to that, you know, in the prenatal period, the obstetricians, prenatal care providers need to be asking that. It's something, I'm so glad you said that, because it's something that a lot of people don't believe is going on in their community, you know. And as I know we're getting to it, I don't want to be a spoiler and all, but you know, the infant formula shortage has brought this issue, you know, really up to the surface where it needs to be. You know, that we need to look at, do our families have enough to feed their children in many ways, and include, you know, infant and young child feeding in disaster preparedness, you know, and what do you do? People would never have guessed that we would be in this position. So it's time to look at all that, but to really reach out with our families and make sure that they have what they need, because those very basic things aren't being met. It affects everything else down the line. We know that.
I'd love to touch on just a second before we move on to another question that just came up to me. Diane, I think you and I first got connected a couple of years ago. We were doing a Health and Hunger Summit series, and we had a pediatrician on the panel who said that she had not heard of the WIC program before. And so she, of course, wasn't referring families because she didn't know that it existed. And so I'd love to hear what we're doing to try and get more information into the hands of providers.
One thing that I think I discussed with you, Kelly, was within my 9 counties here in Southern West Virginia, I have been delivering prescription pads where physicians can actually prescribe WIC. I don't know if you've seen them, Dr. Cardinal, visiting those offices, giving WIC informational brochures, the prescription pads, delivering WIC 53s, WIC 53 pads, contacting the office manager before I leave, chatting briefly with the office manager, requesting an email for that office manager. And then I followed that visit up with sending the office manager a link to the social media toolkit that the American Academy of Pediatrics and FRAC put out. So if they're not addressing food insecurity, then they have that toolkit ready to use.
Yes, and we, just to add, in all of our offices, we have the free posters that are available. You can put them in the waiting room. If the family does not want to share at that time that they're a food insecure household, you put them up in your exam rooms, in the waiting room, and it has links to phone numbers, websites that the family then can contact to get services. But we know that medical providers need to do a better job at screening for food insecurity in all households, and we try our best with information given at the time of their visit in our office, but also we have a very strong support system connections in the community. We know where to direct our families. We have referral people that work in-house. And all of us try really hard to get these families connected once they've been identified.
Great. I think somewhere in our future, we should do a best practices type of YouTube video and get some providers on who can share how they do it, because time is always a problem, right? You only have a limited amount of time with each patient. And so there are a lot of things you have to touch on. And that's one of the challenges that we heard for providers, was that there just wasn't screening for food insecurity. You know, they have to screen for so many things, often incentivized to screen for a number of those things. And so that's a real challenge. So let's talk more broadly. I mentioned before when we first started that looking at 2018 data on WIC participation versus eligibility of infants and children, we see almost 98% of those eligible participate in the program, but then participation wanes as kids get older, down to 26.5% at 4 years old. So across the board, how can we improve WIC utilization in West Virginia? What more could we do? I know you all are doing quite a lot, but what more could we do, especially if you had unlimited funding to do it?
I think there's the feeling right now that this streamlining the whole WIC program process for a participant is going to do it. One of the things that in order to do that, thank goodness, the bipartisan infrastructure law that President Biden and Vice President Harris worked on with the Democrats, Republicans, and independents, so that our WIC participants could afford connectivity. It's called the Affordable Connectivity Program, the ACP, which allows providers to supply internet to our participants for $30 per month, or rather $30 per month off their internet bills. And I think all these things that I was talking about that were in that the package that I was discussing about wiring WIC. There's this idea, and I think West Virginia is moving in that direction, you know, to streamline the clinic experience if they come in, or perhaps we'll have to see, and we'll have to wait just what USDA ends up doing. But streamlining, offering remote participation, or sometimes in person, and of course offering, as Jody was saying, mobile-based, letting the participants maybe order online. Maybe that will help them stay on board with their child until that child turns 5, and maybe that will help our retention. You know, I worked recently with the museum in Beckley, the Child's Museum, and they were wonderful because, and this was an example of leveraging partnerships and how it's so very important within our communities. And they will allow on one day a year, WIC participants using their eWIC card to come in and use it like a pass, and they're not going to have to pay to go to the museum to see an exhibit that would be appropriate for WIC age children, very young. So there are a bunch of things that I think, Kelly, that are going to be, you know, coming out very soon. You're going to see kind of a brand new WIC program in my mind. That's what I'm seeing, but we don't know exactly what it's going to look like. We're kind of halfway there because of the pandemic, and we were forced to do certain things. We were forced to talk with our participants remotely only, of course. What do you think, Jody?
I agree with you. I think the WIC model has to change. And again, that has to come from federal regulation. So we're really hopeful. But I think that the people that work for the USDA, especially the ones that I deal with in breastfeeding, I just feel like they're progressive in a sense of realizing what our families need. And I think, again, Diane had mentioned the cash value benefit that has gone up, and that was something I didn't say earlier, but it is something. Like, it used to be just a little bit, like they would get like maybe $9 for fruits and vegetables. And for me, when I'm at the grocery store, if I'm worried that I'm going to go over or I can't buy all the produce I need, I might be less likely to do things with it. And so by increasing that cash value benefit, I really feel like it's going to stay. And I think that may make a difference in the packages as well, because you're looking at a lot more money per participant. And then that way, when people do go to the grocery store, like we've done a lot of our education piece on what can you do when you go to the grocery store. Like, not everything, they can't buy all fresh produce always, because they might not be able to lug it. It may not make it through the week or for the length of their time, the month. So we've really educated on a lot of things, like how can you do things with canned foods? What can you do with frozen foods? And to kind of really give a lot of good ideas. So I think, again, meeting these people where they are so they can be supported. And again, with the pandemic is the biggest thing. Like, nobody wanted to go out when we were afraid. And the last thing you want to do is take the most vulnerable population and stick them in a grocery store during a pandemic. So I feel like people will, I think, if we progress this program, and again, not changing and overhauling the whole thing, I think it's a really good program. But I do feel like there are some things that lower socioeconomic status families really need that the rest of us use. And I just feel like that we have to modernize our program enough to make sure that those opportunities are available, so then they can use it. If I have to take 2 buses and lug all my children, and again, you're not talking about just a baby. Like a pregnant woman, you come all together, it's in one body. But then when you start bringing children with you, you're carrying a car seat maybe, or a stroller, and then a toddler, and that's a lot to expect people like to jump on a bus and go down to your local clinic or to go to the grocery store. And so again, I said it earlier, and I really feel like it has to be a cost benefit way out for these people, and they have to say, okay, it's worth it to come in and get my WIC benefits and to keep on the program. And I think, as I said, if we modernize even a little bit, it's going to help them stay on longer.
Do any of you think stigma plays a role in people not utilizing it as the kids get older?
I would say yes, more if we didn't do EBT. Because again, I feel like when you have to hand out a voucher or whatever, it really makes it more prominent in everybody's mind. But when you're doing an EBT card, technically, they should not at the grocery store be saying, well, here you are with your WIC benefits. That's not the way it should happen. So in a perfect world, it should be like anybody else using a debit card or a credit card, or it shouldn't be anything unusual. But that doesn't mean that that's always true. And so I will say that. So it could be. But again, people do SNAP benefits. And I don't know, I haven't compared the return on SNAP as people get older versus, and I don't think you see that drop off.
That's really interesting to me, if stigma played a part, because we know that we still have an increase of food deserts in our state. Like Poca, for example, just lost its grocery store. And so, it was Diane who, through an email, put this in my head, which I hadn't thought of, that WIC really does play a part in keeping or staving off these food deserts. It keeps our grocery stores going. And so in a greater context, even if a family felt as if they just didn't need it anymore, right? It was something that they felt they could do for themselves. The fact that they still participated and put that dollar into the local economy really is a benefit to the whole local economy.
I agree.
So anybody have anything else they want to share on that before I pivot over to infant formula shortage? which is completely something different. But it was such a discussion that really kind of brought WIC to prevalence. The uptake in, did states see an uptake in participation in WIC due to the infant formula shortage? And do we have any updates on what that crisis looks like right now?
I can say that we've definitely seen some increase in WIC during the formula shortage. I don't know that I can answer all of the why. Because again, like I feel like my hope, and I think Molly's hope with me, is that we would see a big increase in breastfeeding based on, and I hope we will see this. But it is a lot harder to like relactate and things like that. That's not like, people think it's just like a pat answer. Oh, just relactate. And those of us in breastfeeding, everybody on this call gets it. Like, it's not as easy as that. And there's a lot of like other things to that. But I do feel like, as we talked about earlier, this formula shortage, I think, has really like kind of opened all of our eyes in a way to like, wow. For me, it makes me realize how prevalent the infant formula industry is in our world, in the United States. And so it's, again, I'm in breastfeeding, so it's sad for me. I do think that infant formula is necessary in the world, but I don't think it has anywhere near the necessity or the power. It should have the power that it did in these past few months.
Well, yeah, and I'll echo that, Jody, that, yes, we need formula. Why is it even called formula? Well, because if a mom could not nurse her baby, or in older times when wet nurses were so prevalent, if there wasn't someone to nurse that baby, what did they feed them? Babies don't tolerate cow's milk, any kind of animal milk. That's why we usually say wait till a year. So they had to have something, and it is so much better than it was in the early days when it was powdered milk or evaporated milk, and then, oh my Lord, corn syrup or molasses and all these things. I mean, they literally called it formula because it was whatever recipe people had. And so our formulas are so much better. The problem is that there's such marketing with it. There's a lot of money put into that marketing. It's genius. I mean, I will give them that. It's genius. And
I'm with you.
And they even have healthcare people marketing for them, and they don't even realize it because it comes in the form of, well, here's this gift bag and you can give it to your patients. And hey, that's really nice. I have an office in a community clinic, and and I've seen it everywhere across the board that they have reps that come in and they give gifts, and they give free formula. And so if a mom comes in and she's having a problem, depending on how that's handled, that can go a long way for, does she continue breastfeeding? Are they giving her something to feed her baby right then? But are they also making sure she has a pump and she knows how to use it and she has ongoing help?
Yes.
So there's a lot of pieces to that we can, offer mothers, because the answer is not just to say, just breastfeed, but I think for a long time, it's there, we have built up our reliance on it, because if mothers had a problem, whether it was a family member, or, their pediatrician, whoever said, here, just give them this, and then the way things were marketed, it really, I feel like, and of course I'm biased, but I feel like it undermined moms.
I agree, Molly.
That here's this, and you can do this, and it'll be easier on everyone. So we need to look at that and look at how we can better support our mothers. So we're not just saying just breastfeed or just do this. That's my take.
And I'm gonna weigh in here, because this is part of the thing that I kind of really believe in, is that I think when we give moms samples of formula, in the back of her mind, it makes her feel like, you don't believe I can do this. You're giving me that little piece of doubt, like when I fail, here it is. And again, I'm not trying to say that we don't want a backup plan, and I get that, but I just think when you have the backup plan, it's so much easier in the middle of the night when you're exhausted and stressed to grab that backup plan. And then knowing what we know about milk production, the minute you start getting rid of demand, then you stop making as much milk. So it's like usually that first supplementation is like, it leads you down the path of I'm not going to breastfeed anymore. And again, it's not that if people don't want to breastfeed, that's their choice. But if they want to, and that's their goal, I feel like it's our job, especially at WIC, to really allow these families and support these families to be able to breastfeed and to make sure, that we are there when they're having that moment. And the research shows that they start within that it's within the first 2 weeks that people fail, because if they don't have lactation help in the hospital, if they go home and don't talk to somebody and they have trouble, the first thing, we all feel this way, baby's got to eat. And if you worry for any second that your baby is hungry, I mean, we're a feeding nation. We're going to stick a bottle in their mouth because we want to make sure that baby's fed. It's what we do everywhere. Like, never mind, don't even look at babies and breastfeeding. What happens if someone dies? If you have a friend that has a bad thing going on, we take food. We take food, and that's what we do. And that's how we love, and that's how we support. And so I think, again, it's just a culture change in our society where, I mean, my mom did not breastfeed me. My mom bottle fed me because she said it was fashionable. And I'm like, and again, I get it, but why is it fashionable? Like, to me, that's not fashionable. That's
Yeah.
So,
What really caught me during the peak of the whole formula shortage was that, I saw people on social media saying to women, just breastfeed. And what caught me about that was, it's just kind of the reverse of this whole judgmental, prescriptive way we treat women. And so it wasn't helpful. But also at the same time, what was unfolding was that, women were having their pumps taken from them in airports if they did not have their children with them because of policy. And so what we do is we don't create environments conducive to breastfeeding, and then we shame women when they don't breastfeed. And then you're right, we hand them the formula before they even, at the moment to say, we have your backup. And so I think there are a lot of policies that we should.
I agree. Kelly, you are so right. We give this mixed messaging back and forth, just breastfeed, but we're not, and we don't help. And again, at WIC, I feel like we do, but it's a matter of getting people to the help and getting them there early. And in our hope, having that Pacify app, I thought would be another benefit, because even when lactation, maybe if you don't have a lactation consultant in the hospital and you have your app, I mean, you can be calling your app from the hospital. And I know that that's not the perfect world, but it is for me if you don't have another option. So again, just something. And then because Pacify connects back with us at WIC, we can kind of make that a full closing of the loop and giving that support. But the same thing with having pods. I think the Mamava pods that they have in a lot of the airports and things, I just really think for women, we need more and more options. And I think it's changing as more women that are of childbearing age are in the corporate world and coming up with I need this option. I need a good breast pump. I need this support. And so again, I think at WIC, we want to offer the same things that any professional woman would have at work. And so again, I think it's getting that knowledge out. I hope that we're doing a good job in West Virginia. I really feel like Molly and I, we're constantly trying to meet with people and do things with, we work with other pediatricians. We're doing stuff with, oh God, what is Jamie's thing, Molly? Keys for healthy kids. Yes. And so I just feel like we're trying to connect all of us together and really be aware of the things that we can do, with WIC and with breastfeeding, but also to pull so many other people together. Like Lisa, I'm so glad that you're on this call. This makes me feel so happy and excited, because again, I think our pediatricians do want, people to be able to breastfeed if they want to. And I think with knowledge,
And we encourage them. This is why the American Academy of Pediatrics recommended all babies see their medical provider within 2 days of nursery discharge. It's within the first week of life, and whenever they are discharged from the nursery, so that they can be identified as those that are breastfeeding and need help breastfeeding, and what that medical provider then can offer, like getting information out to them about the breast pumps and how to breastfeed. I observed breastfeeding in my clinic all day long. I help babies latch. All of our providers are trained to do that. I think any medical provider, if they're not trained, there's lots of ways to get educated, because it does really make an impact on these families those first 2 weeks of life. We do frequent weight checks. We don't wait for just a 1 month well baby check. We have multiple touch points for our new parents for breastfeeding help and for feeding help in general, and how to give their baby what is best. To meet their needs in their own household. So there's ways that you can do it relatively easily and quickly in your clinic, and all medical providers should be doing it.
I love that.
I'm so glad you said that, Dr. McBride, that and one of the projects that we have going right now is to, nobody gets enough training. Doctors don't in school, and nurses, like in particular, just around infant feeding period, much less breastfeeding. But it's not just, we're not going to lay it on just the doctors, okay? We're working on a system like that in any practice, any clinic that a mom calls and she has a problem, there's a triage system, and that they don't just get that, we'll get some formula, or just breastfeed on the flip side. We've done getting ready to do in the fall another, it's called Outpatient Breastfeeding Champion Training. And it's a great course for anyone with any level of experience, but particularly aimed at folks that work, say, in a physician office, a clinic. And it starts with very basic breastfeeding information, but it works on some really evidence-based best practice guidelines for making sure that moms work their way through the system, and that may be she hasn't talked to WIC yet. It may be she didn't look into a breast pump yet, or it just may be getting her with, somebody that can just hands-on check and see if she's doing it right. Yeah.
This has been such a great conversation. We only have a few minutes left, so I want to give each of you an opportunity. Is there anything about WIC that we haven't talked about yet that you would like to mention? Please note that we'll put links to everybody's organizations and ways to learn more in the comments section after the video. Does anyone have anything they want to share? Jody, you can always talk about the Regatta.
I know that's true. The regatta is going on this week, starting on Thursday. I think they start at noon on Thursday till 9 p.m. That's Thursday and Friday, and then it's 10 a.m. till 9 p.m. Saturday, Sunday, Monday. For WIC, we're only going to be there the first 3 days because we kind of did a last minute, let's try to do this. And it was really tough to get a whole lot of people to come in and work the booth. But we're going to basically have a breastfeeding booth. So people can come in and be able to observe, sit and breastfeed their kids. We'll have a changing area. We're going to have refreshments and fans. We're doing a pop-up farmers market on Thursday. So people can come, and we are giving free produce out from Critchfield Farm. And so we're really excited. And then we'll have, of course, a lot of outreach materials and things on nutrition and breastfeeding. And I'll be out there. I'll be there. So please come down. It's down at Magic Island in Charleston. So I don't know who's listening to this, but it is in Charleston, and it should be a really good time. There's going to be music. Friday night, they're having a movie. So there's a lot, and it's the first time they've done Regatta in Charleston in 12 years. So this is kind of a big deal for us, especially after the pandemic. So bring your families down, come and get free stuff. We're also going to plant seeds, and the kids can take home and have their own little tomato garden. And so I just think there'll be some really fun hands-on things for us and for families.
I'll chime in last minute. I threw this up there. This is coming soon. It's a work in progress. Can you all see it? It's called zipmilk.org, and West Virginia joined with several other states in the country. It's a directory and all. So it's not done yet, but it's coming soon. This is a one-stop shop. It's for mothers. It's for providers. To be able to go, and you literally put in your zip code, and it will bring up trained lactation folks within your area. Right now, all of the WIC clinics are listed on here, which is the main reason I'm bringing it up right now. We hope to have it fully, many more folks registered by August, which is National Breastfeeding Month, and I will leave it there.
Wonderful. Anyone else?
I was just going to say, I'm on. I didn't even realize I wasn't muted. I do have our WIC number and the website if you want me to share that. I know you said you would, but I can just throw that up. Let me see.
Yeah.
Can I share that screen?
As you're doing that, I just want to say WIC is here to help. Our mission is to improve the health of women, infants, children in West Virginia, and just call us, give us a call.
It's not showing it. What I do.
It is.
Oh, is it showing it? Okay.
It is.
Okay. Yeah, just that's our website, and that's the state office phone number. And they would call and they can talk to someone at help desk, and they can help get them qualified, find out if they're qualified for WIC, just to have that.
And thank you, Kelly, for this opportunity to showcase WIC. We really appreciate it.
Well, thank you. Thanks to the panelists, the Greater Kanawha Valley Foundation for sponsoring this project, to everyone who attends, to everyone who watches in the future. If they have any additional questions or comments, they're welcome to post in the comments section, and we'll make sure and get them connected. And we're going to have all the links to all the things that we discussed here if people want to learn more. So thanks for anyone who joined us. Again, to the panelists, and hope everyone has a great day.
Thank you.
Thank you so much, Kelly.